Kia ora koutou, ko Tiffany taku ingoa, he kaireruku tau whainga aho ki Manaki Whenua. Good morning everyone, my name is Tiffany and I am the Events Coordinator at Manaki Whenua Land Care Research. A lot of you would have joined us previously for a webinar session, but before I hand over to Christine, I'm going to run through a couple of technical slides to ensure that your experience with us online today goes as smooth as possible. If you are new to our LINKOnline sessions, bear with me while I give you a quick intro to our webinar platform. You will notice you have a control panel at the side of your screen. If at any time this collapses, you can bring it back by simply clicking the orange arrow button. If you are having sound issues and you can see my mouth moving, but you can't hear a word I'm saying, please grab the PDF in the handout section, and this has instructions to resolve this quickly. The audio panel is where you can control where the sound plays on your computer. Select the drop-down arrow and choose your audio output. During the presentation, you may have questions that you want to be covered in our Q&A session. You can do this via the chat panel throughout our session today. You will notice it is pretty small and it will be hard to read other attendees' questions. Select the pop-out icon on this panel and drag the corner out to make it as big as you want. You can also use this feature if you're having technical issues and ask me any questions. Questions asked by the audience show as anonymous and a green colour in the chat panel. However, please note we will use your name in the Q&A session. If I respond to you regarding a question, this will show as red. Now over to Christine to introduce you to our 8th LINKOnline session.
Kia ora and welcome to this short session from the team at Manaki Whenua. Audrey and Rochelle are researchers at Manaki Whenua working in the field of ecological modelling. They're also investigators at Te Pūnaha Matatini, a New Zealand research centre of excellence, specialising in complex systems. At the start of lockdown, Audrey and Rochelle joined Te Pūnaha Matatini team doing modelling to support New Zealand's COVID-19 response. In today's webinar, they'll tell us more about those models and how they can help inform policy and operational decisions during the pandemic. With that, I'll hand over to Rochelle and Audrey.
Thanks, Christine. Tēnā koutou katoa. I hope everyone can see our screen okay. So today, Audrey and I are going to tag team our webinar. So I'm going to start off with a bit of a background around the modelling we've been doing over the past few months. And then I'm going to hand over to Audrey, who will take us through some of our more recent modelling, looking at the risk of new cases arriving at the border. But I wanted to start with just a bit of background for those who haven't heard of Te Pūnaha Matatini. So we're a National Centre of Research Excellence specialising in complex systems. And we're made up of a large group of over 70 investigators from a number of different research institutes across the country. And together we bring a very broad range of expertise in different disciplines, really specialising in data and modelling, and using these modelling skills to try and solve problems that arise in ecology and in social systems and in economic systems, and in particular how these systems interact. So in the past, we've worked a bit on other projects involving disease, including the 2016 gastroenteritis outbreak in Havelock North. And we've also got a very good track record of working with decision makers in central government as well. So back in March, when COVID really started ramping up, Sean Hendy, who's Te Pūnaha Matatini's director, based up in Auckland, started pulling together some teams to look at doing some modelling to support the COVID response. And I just wanted to show some photos of the team that Audrey and I have been working with. So as well as Sean, we've been working with Alex James, Mike Plank, and Nick Stein, based at University of Canterbury. And the modelling really evolved over time. So back in early March, TPM released some of its earliest results, and that was looking at various long-term scenarios for an established COVID outbreak in New Zealand. And these use a classic model of epidemics, something called an SEIR model. And then towards the end of March, when we moved into lockdown, was around the time that Audrey and I joined the team. And around that time, we were switching to working with a stochastic model, which also allowed us to look at, as well as long-term scenarios, short-term scenarios, where the aim was to contain or eliminate the virus. And I also wanted to give a shout out because while this modelling was evolving, there's also another TPM team who are based up in Auckland, led by Dion O'Neill, and they've been working on a different kind of model, a complex network model, where you can look at every New Zealander and look at the ways that we interact with other people when we go to school or at work or who we interact with at home. And that lets you split up the different control measures and restrictions into these different layers and simulate what would happen if COVID spread throughout every New Zealander. So there was all this different modelling going on, but what I want to focus most on today is the modelling that Audrey and I were most heavily involved with, and that was the stochastic SEIR model. But first of all, just a bit of an overview from how we went from the modelling through to feeding those results to decision makers in policy and also involved in operational aspects of the COVID response. So with every major model development, we would go through a peer review with specialist panels, and that was really for quality assurance. And then we would also go through some policy review to make sure that the models we were developing were actually fit for purpose and were able to answer the questions that policymakers needed answered. And then once we'd gone through that review, we were able to simulate our models through various what-if scenarios. Things like, what if we stay in lockdown for 4 weeks versus 6 weeks versus 8 weeks? What might that look like for the spread of COVID? And that could then be fed through to policymakers to inform their decisions. We also were able to run more working scenarios to inform operational aspects. So that was things like how many people might require hospitalization during the outbreak, how many people might require ICU, those kinds of things. And we also wanted to make sure our results were openly available to the public, and we did that mainly through mainstream media and also through social media. And this meant that our models and our results were freely available for other third-party users to make use of to develop their own tools. We also developed a simulator app that lets you drive our model and give it a go yourself, which we'll talk about a bit more at the end. But the main model we were working with was what's called a stochastic model, which allowed us to simulate the spread of infection through the New Zealand population, whilst also bringing in different sources of random variation. So this kind of model is more suited when you're dealing with lower case numbers, like we've been seeing in New Zealand. So for our model to be able to be calibrated with New Zealand data and to look at the kind of elimination strategies that we've been going for here, this was a more suitable model to use. And it is what's called a continuous time branching process model. So you can kind of visualize how that works here. So each dot on the screen is an individual, and one infected individual will infect a random number of new individuals, depending on who they've come into contact with. And we're moving through time from top to bottom here. And of these individuals who are infected, some will have symptoms, some will be asymptomatic, and some will be detected and others won't be detected. So here are just some of the core kind of modeling components that go into this continuous time branching process. So we need to know about the size of the susceptible population. We need to know something called the reproduction number, which I'm going to talk a bit more on soon. We also needed to know what control measures could be in place, about case isolation, how infectious individuals were, and we could also include super spreading. So that's where a small number of individuals are driving a lot of new infections in the population. But it's really these two factors, the reproduction number and the control measures, that our work was mostly focused on when Audrey and I joined the team. So that's what I'll talk more on next. So once we had this kind of core stochastic model, we were able to extend it to look at interesting cases like contact tracing, what the effect of contact tracing was in the system. We could also look at different groups of people based on their age, so children versus adults versus elderly, and also groups with different levels of access to healthcare. And then finally, we also looked at different infection fatality rates for different age groups and different ethnicities as well. So with this core model, we were able to explore and extend to look at other situations that were really relevant for New Zealand. And once we simulate our model, this is the kind of output that you might see. So any scenario that you run is based on a number of assumptions. First of all, the underlying model structure is assumed. We also need to make some assumptions about some of the measures and parameters that are fed into the model. For example, the extent of underreporting that you might have. And we also need to make assumptions about how effective the control measures that are in place are going to be and what effect they'll have in the model. Then once we simulate the model, we can track things like the number of new infected cases each day. We can look at, in red here, the number of cases that are actually reported over time, and also the number of cases that might require hospitalization, which would inform operations on the ground. And we can compare a whole different range of scenarios. So we could look at, for example, if you have very fast case isolation versus slow case isolation. And we can look at what might happen if we spend different amounts of time at each alert level. And we can also experiment to see what an outbreak might look like if we had a very effective alert level 4, say, where everyone stays in their bubbles, versus a less effective lockdown, perhaps where people leave their bubble to go and grab a coffee with their mate. Now, as I mentioned before, one of the important inputs for these models is what's called a reproduction number, which you may have heard of before. So this is a measure of transmission potential. Now, the basic reproduction number, sometimes called R0, tells us how many people on average are going to be infected by a single infectious individual. And this is in a fully susceptible population, so everyone has a chance of catching the virus. And for COVID, different studies have reported different values, but we think R0 sits somewhere between 2 and 4. Now, a related measure is what's called an effective reproduction number. So rather than being a baseline, this tells you actually what the R number was at a particular moment in time, accounting for the fact that as you move through an outbreak, some people will have become infected and potentially now be immune to catching it again. And it also accounts for the fact that when we have control measures in place, this is going to be reducing contacts and reducing transmission. And this is a really useful number because if R has a value more than 1, that tells us that the virus is quite likely to outbreak, whereas if R is less than 1, it's more likely that the virus is going to peter out and that case numbers are going to start declining. Now, when Audrey and I joined the team, one of the biggest questions that everyone was asking was, well, what's the R number for New Zealand and how might this change under our different alert levels? But at this point in time, it was really too soon to be able to say that using the New Zealand case data. We just weren't far enough into lockdown. So what we did instead was to look at what was happening in other countries abroad. So we took about 25 countries from around the world, and those were ones that were far enough through their outbreak that they had quite high case numbers already, or countries that had taken a particularly interesting approach to their intervention measures, which we were quite keen to see what effect that might have. For these countries, we pulled together some publicly available data on numbers of cases per day and number of deaths per day. And we also had to pull together from various sources what types of interventions had been in place and when those interventions were put in place. And then from those data, we were able to kind of follow the trends in those case numbers over time. And using theory that's been quite well established in epidemiology, we were able to convert that to a reproduction number and then compare what was the R number before measures were put in place and to what extent was it reduced after those measures. And this let us start to, first of all, group these interventions into the equivalent of New Zealand's alert level 1, 2, 3, and 4, and look at to what extent was the R number reduced under each of those alert levels. And that's what this plot on the left shows here. So this gave us quite a nice indicative range of measures for each alert level and also for various effectiveness levels. which we could then use to plug into our models and get a feel for just what effects these control measures were going to have on the R number. Now, I just wanted to have a look at some examples in particular that were quite interesting. So first of all, here are two countries that have put alert level 4 restrictions in place. And what these graphs show is this effective R number and how that changes over time. So for Italy, you can see early on in their outbreak, they had quite a high R number, somewhere between 2 and 3. And then after a national lockdown was put in place, and after a time lag of about 2 weeks, they managed to get their R number below this threshold for outbreak. It's R equals 1. And they've managed to consistently keep it below 1 since their outbreak started, and cases have continued to decline since then. Now, slightly different situation in Singapore, where under alert level 3, they were actually looking like they were heading in a good direction already and getting their R number reduced. However, about a month into their outbreak, they underwent this massive second wave, which was really driven in large clusters being discovered within very overcrowded migrant dormitories. And so it took them about another month after that to be able to get their R number back down below 1 and kind of maintain it below that level. Now, another two countries we looked at that had less stringent control measures in place. First of all, Sweden, who have taken a slightly different approach, keeping public venues open, restaurants and cafes open, in an attempt to try and start to build up immunity within the population. So when you look at the R number for Sweden, you can see that it's never really consistently dropped below 1. It's kind of meandering around that threshold for outbreak. And in the meantime, their numbers of cases and numbers of deaths have now kind of far surpassed their neighbouring Scandinavian countries. And we expect new cases to keep arising each day until they're able to get that R number below 1. And finally, in Brazil, which you've likely seen in the news, so Brazil had what we have placed at alert level 1 restrictions at a national level. And although some states and cities did have localized lockdowns, many of them started to ease around the 20th of April. And you can see that their R number has never really dropped below 1 at all. And unfortunately, cases and deaths have really climbed to very high levels, second in the world at the moment. But the big question we really wanted to ask was, what was the R number for New Zealand? And that's what, towards the end of April, we were finally able to address. And we did this by simulating our model and doing that for a range of different R values. And then we looked at what R values gave the best fit to the data. And that allowed us to come up with an estimate for an R value before lockdown, which we think was about 1.8. And then after lockdown measures were put in place on the 25th of March, this R number dropped to a relatively low value of 0.35, which compared to other countries is really quite exceptionally low. And we think this is because New Zealand was just so quick to act and move into alert level 4, and that we potentially had actually what was quite an effective alert level 4, and people maintained good social distancing, lots of hand washing, so we were probably in that high effectiveness level. And then for these alert level 3 and alert level 2, there weren't enough case numbers over this point in time to be able to estimate R, but you can see here we can still make assumptions for simulating the model as to what those R numbers might be, and compare those simulated results to the case data that we do have. And then finally, towards the end of April, we started to see case numbers dwindling, which was great news. And then towards middle of May, we were seeing consecutive days where there were no cases reported at all. So at that point, we switched to using our model to try and tell us how likely it was that we'd managed to eliminate COVID, given that we were no longer seeing new reported cases each day. And that's what this graph on the right here shows. So our model estimates that somewhere between 2 and 3 weeks, with consecutive days of no new reported cases, we can say there's a 95% chance that at that point COVID has been eliminated in New Zealand. So then, as you'll know, on the 8th of June, we declared elimination and we moved down to alert level 1. And at that point, the team shifted our attention to looking at the risk of new cases arriving at the border. And with that, I'm now going to hand over to Audrey, who's going to take us through the next section of modelling.
So hi, everyone. So the first thing we started looking at was the number of imported cases we had in New Zealand. So that's the graph you can see, number of imported cases by arrival date. And one of the characteristics is that we had a beginning of this invasion curve totally dominated by those imported cases, and those numbers have reduced, and we had about a month, more than a month, with no reported cases linked to an international travel. And since a few weeks, you've probably seen in the news this surge in number, and we're just trying to explain and see what happened there. So some of the factors that could explain that are the number of people simply crossing the border and entering in New Zealand, where they're coming from, the level of community transmission in those countries, and also this idea of trusting the level of confidence that a low case count actually reflects a low case number and not an insufficient testing. So I'm just going to go quickly through those different factors. So if we first look, and Rachel, if you could go to the next slide, at the number of travelers arriving in New Zealand, we had a beginning of, at the end of March or end of February, beginning of March, people were rushing to come back home, and we were at about 100,000 travelers arriving in a week. And this has really reduced in May, where we were at our lowest number of travelers. We were at about 1,000 travelers per week. And since the beginning of June, this number has more than doubled again, putting more pressure on our quarantine facilities. Not only has the number of travelers increased, but also the prevalence at source. And if Rachel, you can move to the next slide. This has been quite important, where you can see in purple the average prevalence. It's a weighted prevalence in the country of origin, where those different travelers are coming from, as well as in blue, the prevalence in the country where people got infected. And this is really increasing currently. One other aspect is the testing. And so until June 9, we were not regularly testing people entering in the country. Our understanding is that we were testing them only if they develop symptoms. So it might suggest that until 9 of June, we had almost nobody developing symptoms, or very few mild symptoms that could have been mistaken for something else, or we just didn't have any infected person, maybe because people were coming from countries that were at low risk. And since June 9th that we are testing people, we are starting detecting new cases, simply because we're also routinely testing everyone, and so we are also detecting symptomatic as well as asymptomatic cases at the moment. If we look a little bit deeper into where people are coming from, so we see more and more diversity. People are able to come home at the moment, but obviously quite a strong demand from the US and the UK, as well as Australia, and recently a huge increase in number of people coming back from India and South Africa, where we know that the virus is really widespread. If we look at where our imported cases got infected, that is still under investigation, simply because it's quite hard to attribute a country to a case, because people report not only where they've been, but also where they transit. So we're still working to clarify a bit the country of origin. But it seems that most of our cases at the moment are coming from the US, the UK, and Australia, but a switch in the last week with more and more cases coming from India. So whether we will be able to profile country and determine if we could identify low-risk country and high-risk country is still under investigation. Moving on to our next slide. At the moment, what we are quite confident is to say that we are expected about 4 cases per 1,000 travelers. And if we look at when those travelers develop their symptoms, some of them develop it before they arrive to New Zealand, which is the day 0. Most of them developed those symptoms just after they arrive in the next few days. But what is a bit scary was that 7 cases developed their symptoms 2 weeks after arriving in the country, so once they left those quarantine facilities. This was really at the early of the outbreak, and I suppose that now we have more rigorous testing and this number is likely to decrease. So one of the other things we've tried to do was to put all those information into a regression model to try to predict over time those cases arriving in New Zealand. And I'm not going to get much more into detail at the moment because we're running a bit out of time, and I would like to present you a model of quarantine that we have. The main key message here is that we are having a little difficulty with the data set we have, just because we're lucky to have such a few cases in New Zealand. And the main issue we have is that a lot of travelers were coming back from group travel and cruise ship, and we're still not able to fully understand what's the prevalence in those group travel and cruise ship, and also this inconsistency in testing. It was an issue to fit a model, so we suppose that now that we have more consistent data, we'll be able to calibrate a bit better those models. So a big shout out to Nick that is currently developing a quarantine model. So the idea is that we have some good idea of the number of people that can cross the border and can be infected. We're pretty sure that those 14 days of quarantine are good to limit a new outbreak in New Zealand. But what we are not sure at the moment is how many cases we've missed, and once they go out of quarantine, how infectious those cases are, and how much internal transmission we have within those quarantine facilities. So Nick is looking at the new testing system that is in place. So he's simulating travelers that can be infected, and those travelers will be tested on day 3, on day 12, and daily checked on symptom, and if they developed any symptom or if they have a positive test, they move to a different quarantine facilities where they totally isolated, and we assume they are not infected anybody anymore. So then he looked at those missed cases that we can have, and so what he checked was how infectious they are likely to be if we miss them and they go out of the quarantine facilities. And the good news is that most of those cases are almost at the end of their infectious period, so they are much less likely to transmit the virus to anybody in the communities. What is more problematic is if someone arrives in New Zealand not infected and catch the virus while in quarantine. And if Rachel, you can move to the next slides. To be able to measure this level of transmission within the quarantine facilities is quite hard. This R node that Rachel was talking about. So one of the only information we can get is the results of those tests at day 3 and at day 12. And what we can look is at this ratio of case detected on day 12 in relation to day 3. So Nick looked at different scenarios. He simulated so an infection in the quarantine facilities. And if Rachel, you can go to the next slides, please. he simulated 4 scenarios, and this is really a preliminary work where you had no transmission in the quarantine facilities, low transmission, moderate, and high, what you see on the x-axis, and what this ratio could look like under those different scenarios. And he plotted that against the level of simulated transmission within the facilities. And Rachel, if you can show us that. And the good news is that this ratio seems to be a good indicator of the level of risk of transmission within the facilities. It's too early to use real data at the moment, but we are hoping to get the same graph for our facilities at the moment in the coming days or week. Scenario that Nick is looking at, and that's going to be my final word today. It's looking at the effect of separating arrivals near the end of their stay from those who are just entering in the country. What additional risk exemption could pose, and how can we make them safer? And a big question at the moment is, can we relax some rules for people coming from safer region? So you've probably heard about the Australian, New Zealand bubbles. How can we reduce the quarantine time? Do we need the quarantine time? So that's where he's taking the model at the moment. With that, I'd like to thank you all for listening. You can find those papers and try the model yourself on this link, and I think you will receive the slide later on. And I just would like to acknowledge our wider team. So we had obviously people doing the modeling with us, but as well a really big team of people reviewing our work, putting input into our work, and as well as people providing data and funding. So you can find an unexhaustive list here. And thank you for listening.
Thank you very much, Audrey and Rochelle. It's been so great to see what's going on under the bonnet with something that we've all cared about so much over the last few months, and everybody's been impacted. And it's been great to see how the general population have engaged with the science as well. We have had some questions come through on the panel, and we don't have time to answer them. But the good news is that the GoToWebinar platform allows us to capture those questions, and we will publish those results up on our website along with the recording of today's seminar. That will happen in about a week's time, and we will make sure that people who have taken the time to ask those questions get a response directly from us as well. I have to say they're quite technical, so we could be on here for hours. Just before we finish, I do want to let you know that, as well as Audrey and Rochelle's ongoing work about what's happening with the path of COVID-19 in New Zealand, Manaaki Whenua is also doing some research on social and economic impacts and strategies. So I hope that we'll be able to bring you some further seminars on this topic that so many people obviously care about so much. In the meantime, we've got another hot topic next week, and that is regenerative agriculture. A little bit different, but very pertinent to how we think about how we live in the future. So with that, I'd like to say thanks to everyone for attending and staying with us. A huge thanks to Rochelle and Audrey for a really compelling seminar, and watch this space for answers to those questions. Thanks very much.